Welcome to the GoalZero Toolbox Talk series. Today's Toolbox Talk: work-related asthma. Work-related asthma is caused by breathing in chemical fumes, gases, dust, or other substances on the job. It can result from exposure to an irritating toxic substance. When you breathe in certain chemicals, known as respiratory sensitizers, nothing may happen at first. But over time, your body may react to these chemicals, and you can develop symptoms like those of cold or mild hay fever. Exposure to a substance you're sensitive to which causes an allergy-type reaction called sensitization. These symptoms may include wheezing and coughing, shortness of breath or difficulty breathing, and chest tightness. After being exposed to these chemicals over several months or even years, you can become sensitized to the point where even the tiniest trace of the substance will cause you to have a severe asthma attack. If work-related asthma is not correctly diagnosed and steps are not taken to protect yourself or avoid exposure to these chemicals, asthma attacks can occur frequently, resulting in permanent damage to your lungs, a life-altering disability, or even death. Workers who are most at risk of developing work-related asthma include those who perform the following tasks: cutting hardwood, installing foam insulation, using epoxy resins or glues, soldering, working frequently with chemicals that may cause respiratory sensitization. In addition, people with allergies or with a family history of allergies are more likely to develop work-related asthma. In cases where a person already has asthma, substances in the workplace can make their symptoms worse or increase the frequency of attacks.
Sensitized workers can experience symptoms either as soon as they are exposed to the sensitizer or several hours later, e.g., at home, or at night.
Even if exposure to the sensitizer stops, asthma attacks can continue for years after. Work-related asthma caused by exposure to a chemical at the workplace can also be triggered by other substances, such as smoke, mold, irritant dust, or even cold weather. Read the WMS labels and safety data sheets, SDSs, for the substances you work with. An SDS will tell you if a chemical is a respiratory sensitizer. Some examples of respiratory sensitizers are
dust from certain wood, e.g., western red cedar isocyanates, e.g., polyurethane products, mold, latex.
Replace any substance that is identified as a sensitizer with a less harmful substance. If this is not possible, avoid exposure to workplace substances that may trigger an allergic reaction by doing the following: isolate the work area where the sensitizer is being used or totally enclose the process. Work outside or in areas with good ventilation. Set up local exhaust ventilation in the area. Use the respirator as specified in the SDS.
Handle substances with care, e.g., use good housekeeping techniques to avoid spills.
Report any concerns about exposure to sensitizers or any symptoms of workplace asthma to your supervisor. Tell your doctor if you work with sensitizers and visit them as soon as possible if you suspect you have symptoms related to asthma. Treatment for workplace asthma is like regular asthma and generally includes taking medications to reduce symptoms.